What is fatty liver? Fatty liver, also known as hepatic steatosis, is a condition characterized by the accumulation of excess fat in the liver cells.
Causes of fatty liver.
This can be caused by a variety of factors, including alcohol consumption, obesity, insulin resistance, high levels of triglycerides in the blood, and certain medications. There are two types of fatty liver. 1. Nonalcoholic fatty liver disease, NAFLD. 2. Alcoholic fatty liver disease, AFLD. NAFLD is the most common type and is typically associated with obesity, insulin resistance, and metabolic syndrome. AFLD is caused by excessive alcohol consumption and is typically reversible with abstinence from alcohol. In the early stages, fatty liver may not cause any symptoms, but as the condition progresses, symptoms such as fatigue, abdominal pain, and jaundice may develop. Fatty liver can also lead to more serious complications such as liver inflammation, fibrosis, and cirrhosis. Diagnosis of fatty liver typically involves blood tests, imaging tests such as ultrasound, CT or MRI, and sometimes a liver biopsy.
Treatment of fatty liver.
Treatment of fatty liver involves lifestyle modifications such as weight loss, a healthy diet, regular exercise, and avoidance of alcohol and certain medications. In more severe cases, medications or even liver transplantation may be necessary.